Hi viewers, welcome to my channel. Today we will be discussing Jones criteria for diagnosing acute rheumatic fever. Jones criteria has major criteria and minor criteria. Major criteria include migratory polyarthritis. This is a temporary migrating inflammation of large joints, usually starting in the legs and migrating upwards. Number 2, carditis. Number 3, subcutaneous nodule. These are painless, firm collections of collagen fibers over bones or tendons. They commonly appear on the back of the wrist, the outside of the elbow, and the front of the knees. Erythema marginatum is a long-standing, non-itchy reddish rash that begins on the trunk or arm as macule, which is spread outward and clear in the middle to form rings, which continue to spread and join the other ring, ultimately taking on a snake-like appearance. This rash typically spares the face and is made worse with heat. Sydenham scoria. These are characteristic series of involuntary rapid movement of the face and arms. Now let's discuss minor criteria, which include arthralgia. Arthralgia is a joint pain without swelling, fever more than 38.5 degrees centigrade or 101.3 degree Fahrenheit, raised erythrocyte sedimentation rate or C-reactive protein, ECG which shows prolonged PR interval. ECG and arthralgia cannot be included in minor criteria if arthritis and carditis are present in major criteria. The diagnosis of rheumatic fever can be made when two major criteria or one major plus two minor criteria are present along with the evidence of streptococcal infection. Now let's discuss evidence of streptococcal infection. Throat culture remains the gold standard for confirmation of group A streptococcal infection, but sometimes other antibody tests, which include anti-streptolysin O titer, anti-streptococcal DNase B titer, and anti-streptococcal hyaluronidase test, which can be done to confirm the evidence of streptococcal infection. That's it for today. Thank you for watching.